Welcome back to Health Facts at UBC TV. My name is Kirabo Caleb Kimeze. Today we're going to be talking about an interesting topic, that is sickle cell anemia. Sickle cell anemia, this has been a disease on each and every person's lips. A lot of myths have been talked about sickle cell anemia. Today we are here to learn, relearn, change the information we had. A lot of myth information have gone around the world that these children don't survive beyond 12 years. And some people say that these children are because of a curse from God. Or some people say they are children due to poor satisfaction of the gods. However, that is said by the local people. Looking at the statistics of sickle cell in Uganda, according to the statisticians, they say that sickle cell has been on a rise in the northern region of Uganda. According to the research that was made in 2014 by Makerere University, of course, the science department, in conjunction with other scientific organizations from abroad, they found out that in northern Uganda there is a rapid rise of sickle cell disease and malaria. And it was given a percentage of at least 19%, where malaria was given a percentage of 53%. We don't take that for granted. 16% is quite a lot when you look at the billions of people that are living in the mighty country, Uganda. Talking about sickle cell, you know, this is something that people talk about, but do you know what sickle cell is? However, before I define what sickle cell anemia is, you know, sickle cell comes from two words, one English word and then one scientific word. Sickle is an English word that means something that is crooked, and it is sickle-like. If you guys have been here the past times where our grandmothers, our grandpapas used to cut down grass, you know, for making the houses, they used to use this instrument called the sickle, you know, to cut down that grass. So sickle cell anemia got its name due to the resemblance of the red blood cells, like that instrument that is used to cut down grass. Then cell is a scientific name. It's a scientific word that means the smallest unit of life. Sickle cell anemia is a genetic hemoglobin disorder. It is a genetic hemoglobin disorder whereby the red blood cells that are responsible for carrying oxygen, you know, from the lungs to the heart, and then the heart pumps, you know, the oxygenated blood to all parts of the body, changes shape from the shape we know, that is the smooth like donut shape, into a sickled shape, or some scientists call it a half moon shaped or the crescent form. To take you back, the normal shape or the normal anatomy of a red blood cell, it is supposed to be round as a donut. If you guys have enjoyed this bread called the donut, you know, so the red blood cells looks exactly like that donut. However, according to scientists, they say that in between or amidst or in the center of the red blood cell or in that donut-like structure, there's a red pigment we call hemoglobin. And therefore, it is this hemoglobin that is responsible for binding with oxygen to make oxyhemoglobin that is transported throughout the body. When it comes to sickle cell, the shape of the red blood cell I've talked about changes its shape, you know, from the smooth one into a sickled, you know, a sickled structure. What causes sickle cell? This is interesting. What causes sickle cell is just a little substitution. You know, you guys have heard about substitution, you know, like a football match. You pull out a player who is tired, and then you bring in a tired one. I mean, a strong one and a fresh one. The reverse is true when it comes to sickle cell anemia. For sickle cell anemia, it is caused by a defect in the beta chains, you know, that make up the hemoglobin, whereby at a certain number of amino acid, the amino acid valine is substituted by something that is not good called glutamic acid. Looking at the structure of the hemoglobin, it is made up of the beta chain. Now, this beta chain is made up of amino acids. And then these amino acids, when brought together, they make a chain, the one we call the beta chain. So now, these amino acids are given number 1, 2, 3, 4, 5, 6. Now, how does someone get sickle cell anemia? What happens is interesting. There is substitution of the amino acid number 6. Okay, there is substitution of the amino acid number 6. And now, the name of that amino acid number 6 is called valine. So, when there is a substitution of valine for glutamic acid, it leads to formation of a defect hemoglobin, the one we call HbS. However, according to scientists, they say that the symptoms of sickle cell anemia start to show up after about 3 to 6 months. Scientists explain this, that is the time when the child has gotten rid of the hemoglobin from his or her mother. And at that particular time, the child has started generating what we call the fetal hemoglobin. So the reason as to why sickle cell anemia can't be detected in the first 1 or 2 months unless given critical attention or investigations of a highest caliber are done. It's because that at that time the kid is still depending on the blood cells or the hemoglobin that was attained from the mother. And as the child clocks 3 to 6 months, at that particular time, the child has started generating his or her own cells and his or her own hemoglobin that sometimes are defected due to the substitution of valine for glutamic acids. Like I said, that the symptoms start from 3 to 6 months. Now, when you look at these kids, they're always troubled with chronic anemias, anemias that do not resolve, anemias that are repeating. A child comes to the facility with these lower hemoglobin levels, and the child is treated, maybe transfused with blood, and just after 1 month or 2, the child comes back again due to depletion of hemoglobin. At that particular time, your doctor or your clinician may be much more interested in knowing whether this kid is a sickler. Then the other thing is these kids are always troubled with recurrent bacterial infections. When you take off a blood sample from them, you'll find out that their white blood cells, or the WBC count, is elevated. It's more than 12. According to scientists, they say that the normal range of the white blood cells, at least it is supposed to be between 4 to 11 or sometimes 5 to 12, depending on the calibration of the particular CBC machine. Then the other thing is these kids normally present with recurrent lobar pneumonias. They have the respiratory distress, they have the coughs that are not getting better, they have DIBs, difficulty in breathing, and they come and go. These kids, they never settle. They never have, that interesting life unless being attacked with these recurrent lobar and bacterial infections. Well, these kids have always been attacked by crisis. Now, crisis is an English word. A number of times politicians have used it, showing that there is something that is not going on well in a particular country or within a body system, like we had a fuel crisis. So it's an outbreak that sometimes come uncalculated or sometimes come unexpected. So these kids always face a number of crises in their lives. A kid sleeps well, and in the following morning only to hear that the kid was attacked with a crisis. One of these crises, we have what we call chronic anemia. Chronic anemia. like I defined anemia, anemia is simply the depletion of blood or reduction in the hemoglobin levels. Like I've always said here, that the normal hemoglobin levels for a man, it is supposed to be at least 12 grams per deciliters and above, okay? 12 grams per deciliters and above. When it comes to a woman, it is expected to be a little bit down. You know, it's 11 grams per deciliter and above. Even when it comes to pregnant mothers and babies, yeah, it is slightly low because now for the pregnant mother, we all know that there's two in one. Two things are depending on a certain concentration of blood. So we expect the hemoglobin levels at that particular time to be a little bit down. When it comes to the non-pregnant mothers, also they are undergoing the menstrual process, I think monthly. So this explains why their hemoglobin levels are kind of lower than that of the men or the males. Well, going back to sickle cell anemia, these kids, their hemoglobin levels are always between 6 to 9. That explains a gradual decrease in the hemoglobin levels. And when that is found, your clinician or your doctor picks in an interest in finding out, is this kid being affected with sickle cell anemia, or may be much more interested in knowing what is causing the dramatic fall in the hemoglobin levels of a child. Then, according to scientists, they attribute these chronic anemias to basically to two things. One, they attribute it to what they call a plastic crisis. Now, a plastic crisis is simply a transient arrest of production of red blood cells from the bone marrows. So scientists believe that kids who are sicklers, they reach a particular time when their bone marrows can produce more red blood cells. And when we take off blood samples, of course, we shall be able to detect a decrease in hemoglobin levels. Like to take you back, that in our bodies, it is the bone marrow that is responsible for production of blood cells. So if there's a transient arrest in production, then that means that there will be a decrease in the levels of hemoglobin in our bodies. Then the other thing is scientists attribute the chronic anemias to what we call the splenic sequencitrization. Well, splenic sequencitrization is just an interesting crisis that someone out there would love to know more about. Guess all of us who have encountered sicklers or patients or children with sickle cells, a number of times they have presented with this gross enlarged, spleen. When you try to palpate in their right side of the abdomen, you'll find that there's an enlargement of the spleen. Now, this is attributed to what we call a pool of the blood cells from the body into the spleen. To take you back, it is well known, according to science, that the spleen is designed to destroy red blood cells that have reached their life expectancy, or red blood cells that have been damaged. Now, when you have sickled cells in your body, sometimes the spleen encodes or reads the damaged, red blood cells. The sickled red blood cells as being damaged one. So at that particular time, the spleen will do what we call a pull. Will pull these sickled cells out of the circulation, and they will be accumulated in the spleen. At that particular time, we expect two things. One, we expect decreased hemoglobin levels because the red blood cells have been removed from the circulation. And then the other thing is, of course, we expect the gross enlargement of the spleen. Well, the second crisis that is so common in kids with sickle cell, there's what we call the vaso-occlusive phenomenon, or some scientists refer to it as occlusion of the blood vessels. Now, this is a common crisis that has been, that has attacked many children or many people with sickle cell disease. Now, there's what we call the painful crisis under the VOC, or the vaso-occlusive phenomenon. Now, this is a time where the child presents with severe pain in the back, severe pain in the lower limb, severe pains in the chest. Now, this pain is a pain out of the blue. Someone sleeps well, and only to wake up in the morning, he's feeling the back pain, he's feeling the joint pains, he's feeling pain in the arms, he's feeling almost pain everywhere. Now, scientists attribute to this pain as being as the sickled cells make like they make something in the vessels. They occlude, okay? They occlude, they make something in the vessels, and that will prevent blood from flowing smoothly, through the vessels, because the sickled cells, they don't have the other smooth shape we know. Now, they are sickled. Now, at some particular time, they do what we call entanglement and clog within the vessels. Now, that will prevent continuous and smooth flow of blood. So at that particular time, blood will not flow with ease, but they will be difficult, and blood will have to flow with a lot of resistance. And at that particular time, the child or a patient will be able to feel a lot of pain. Then the other thing is still under the vaso-occlusive phenomenon. There's what we call the acute abdomen, or what we call the mesenteric crisis. During this crisis, children will present with distended abdomen. They will present with distended abdomen, severe abdominal pain. They even present with a history of continuous passing out of loose watery stool. And sometimes even they present with history of vomiting, okay? And when an abdominal, ultrasound scan is done, or when the bowel sounds are listened to, there will be reduction in the bowel sounds, and when an investigation is done, there will be increase or increased diameter in the bowel lobes. So acute mesenteric crisis is so common in children with abdominal distension, abdominal pain, severe vomiting, and severe history of passing out loose watery stool. And then the other thing is we have what we call the acute chest syndrome. Now, the acute chest syndrome, sometimes it goes misdiagnosed, because a number of clinicians, a number of doctors, think it is just a simple upper respiratory tract infection or a lower respiratory tract infection. But in an acute chest syndrome, kids or patients will always present with that severe chest pain, and they will always be in the respiratory distress, difficulty in breathing. Sometimes they present with that intercostal recession, severe chest indrawing, all those elements that make up the respiratory distress. Well, when you put a pulsometer, when you try to, to measure the levels of partial pressures of oxygen in their bodies, trust me, they're always below 90%. I could say that acute chest syndrome in sickle cell disease is an emergency. Still looking at still looking at the vaso-occlusive phenomenon, where we are trying to look at the painful attacks or the painful crisis. Remember, we talked about the acute chest syndrome, we talked about the acute abdomen. Now we are talking about the renal infarction. Sometimes this presents with necrosis and priapism. A few days ago, I received a sickler. Was a 10-year-old male. He presented with this painful erection of the penis. The penis wasn't resolving at all. And you see, the kid gave history of this happening for about 3 days. So it is painful. It is not resolving. That condition is referred to as priapism. So these conditions will always attack these sicklers unexpectedly. You wake up normal, only to realize that you've gotten an erected penis that even though given muscle relaxant, it doesn't resolve. Still under the crisis we are looking at in sickle cell, there's this one. It is called the chronic organ damage. Now, this comes as if a sickler has not been managed, or if there's late diagnosis of sickle cell disease. Now, only to realize that some organs in human beings or some organs in a sickler have already been damaged. Remember, we have vital organs in the bodies, and one of them is the kidneys. We have the brains, by the way, the liver. So sometimes you realize, like we said, there is that enlargement of the spleen. Already, the spleen is damaged, and at some point, it can lead to a removal of the spleen when it no longer performs its function. Yeah, there's a number of things that we can look at in the broad organ damage. How can we investigate? What do we do if we suspect someone to be having sickle cell disease? The first thing we do is we take what we call family history. We take this history from the close relatives. You'll find us asking the patients that, has your father ever suffered from sickle cell disease? Or has your mother ever suffered from sickle cell disease? Or has maybe your grandpas or your grandma? In that way, we are trying to investigate. Maybe because we say that it is a genetic disorder. So that means it is a disease that is moving through patterns of blood, the genes that can be transferred from one person to the other. And then the other thing is we do what we call the full blood count. And remember, we talked about the chronic anemias that these kids always get. And we talked about the continuous or unresolving bacterial infections. So when you do a full blood count, you realize that the white blood cell counts are always at the peak. They're always 15 and above. And when you try to look at the hemoglobin levels, we said that they're always between 6 to 9. Now, we do what we call screening tests. Now, one of them, there's what we call the peripheral blood film, or what we call the PBF. In that way, blood samples are taken off from the person who is suspected to be having sickle cell, and then they are read under the microscope. At that particular time, the lab technician is much more interested in looking at the morphology of the red blood cells. Remember, we say that the anatomy of the red blood cell has changed its shape from the smooth donut we know into a crescent form or a half-moon shaped cells. Now, at that particular time, if crescent cells are detected under the microscope, well, we can conclude that this child is having sickle cell disease. And then we have what we call the confirmatory test. It is called the HB electrophoresis. Now, this is not done at every health facility. It is done at the national laboratories of the countries where blood samples are taken off from the lowest facilities, and it is taken for further investigations. Of course, we have some other investigations we can do. We can do radiology. We can look at the chest. You know, we can do the abdominal ultrasound scans. We try to look at the kidneys. We try to rule out the organ damage like we talked about before. Now, treatment of sickle cell. Now, just of recent, according to scientists, we've not yet gotten one way of how we can manage sickle cell. However, these kids have been started on certain medication that is taken daily, monthly, as prescribed by your doctor or your clinicians. Now, in this way, we have what we call the daily folic acid. Yeah, this folic acid is given to these kids daily, one way to resolve or to counteract the anemias. And then they're always given this monthly Fansida, yeah, in order to put a measure as a protective or a prophylactic measure known to get malaria. They have also been started on PenV. Remember, we say that they have these recurrent bacterial infections. So if they are given PenV, it helps them not to be as a prophylactic drug against bacterial infections. There are quite a number of medication, and the last medication we normally give them is the hydroxyurea. Now, hydroxyurea, a decision to start a sickler or a person with sickle cell disease must come from the doctor or as a team of doctors, because it comes with a lot of investigations first before this drug is started on a person. Because of time, let me just quickly take us through on how we can, the community and the people individually, how we can cut down sickle cell, or how we can take care for the people suffering from sickle cell. Well, like I said before, that these kids need maximum attention. They need maximum care. And talking about maximum care, I'm trying to talk about the environment. I'm talking about the feeding. These kids need to be fed, they need to eat in time, they need to be advised on what to eat and not what to eat. Remember, these kids are having the chronic anemias, so that means they need to feast on food that is rich in vitamins, that is going to boost, their defensive system, the WBCs, in order to fight, against the bacterial infections, the lobar pneumonias, and the so on. Then the other thing is we really need to emphasize a point of drug adherence. These kids really need to take their medication as prescribed by the health worker. And then the other thing is these kids are, I won't say they're fragile, but they need that maximum care, like I said before. If it is coldness, please offer them an extra jumper. If they're going to school, talk to the school administrators such that they can allow them with extra sweaters to cater for the coldness. And then the last part is what we call couple counseling. We counsel the couples before they get married. And sickle cell disease is a disease that is transmitted through what we call genetic mixing. So someone may be a carrier, may not be a sufferer, may not show the symptoms, but may have the trait that caused the disease. And now, when carriers marry each other, there is a chance, in fact, a greatest chance, that these people are likely to give birth to a sickler. So if genetic counseling is done, investigations are done, before people getting married, in one way or the other, we shall be trying to relieve the burden or the increase of sickle cell disease in the mighty country, Uganda. And then the other thing, as I've always said, it is always a collective effort. It's the team. It starts with an individual, the community, the government, and the country at the large. So when we come together, I have a belief that sickle cell disease may be curbed down. Thank you so much for watching Healthy Facts at UBC TV. Let us catch up in the next Healthy Facts program. Bye. I remain Kirabo Caleb Kimeze. I sign out.